This is Selma Schimmel at the Community Cancer Care Advocacy Day Forum in Washington, D.C., joined now by Tom Kean, CEO of CChange. Hello, Tom.
Hi, Selma. Nice to be here.
Take us back a little bit to the founding of CChange.
Okay. Well, CChange was founded in 1998, and this was an idea that was birthed by a few individuals, and they included the first president and Mrs. Bush, and who were our founding co-chairs. And they got the idea and this vision based on their own experience with losing a daughter at a very young age. And that drove for them a lifetime of volunteerism related to cancer, and it's been awesome, culminating in the CChange adventure. And I think what happened at Selma as a part of this is their investment of their time and energy to say, we have to bring people together to work, and we're going to use the power of the former presidency in order to make that happen, was a game changer in the cancer world, because many of us had not spent any time talking to each other. We're too busy focusing on our own mission. They were an awesome, awesome couple, both as human beings, but in their commitment to this disease.
Why don't we explain what is CChange and the mission of CChange?
The idea behind CChange is there's a lot of organizations who work on cancer issues. And at the end of the day, the question is, if you put all the leaders from those organizations in the room and you ask the question, what's going undone while we're all doing our own good work, then we can find collaborative things that we can do together that we'll all benefit from. And so having individual members like yourself and from other organizations, from the public, the private, the not-for-profit sector, sit in a room, people who don't normally talk to each other, and deal with the questions of what can we do as a group and as a collection to advance cancer care in this country is exactly what CChange is all about.
When I go to a CChange meeting, I always feel like I'm sitting in a think tank. Mm-hmm. And I like that feeling a lot because it's the interfacing from so many of us from different disciplines that would rarely get to be in one room at one time.
I think that is one of the great benefits of CChange, and as I mentioned a moment ago, it's like if you have the opportunity to sit with people you never sit with, and you tell them your story or your agenda or your passion, they tell you theirs. And we quickly find that on a lot of these things we intersect in our interests. But the point is we bring different perspectives about both what the problem is and what to do about it. The nice thing about CChange is that it does provide that think tank atmosphere. But the real beauty of CChange ultimately is in the action that we choose to take together. And I think this idea of thinking together and then acting together is exactly where we're at.
What is the real mission if someone said, well, what is CChange? We all know the expression CChange, but in this case, what does the organization stand for?
Our big aspirational goal in this is we want to eliminate cancer as a major public health problem at the earliest possible time. We do that by leveraging the expertise and resources of our members. But we have the opportunity right in front of us now with things that we already know, as well as things that continue to emerge, to make a huge dent, a much bigger dent than we've been able to make in the cancer problem. Ultimately, we want to get rid of cancer. And I think the important thing is we have things we can do right now that make that move and ways to take advantage of the new things coming along so that we can more quickly stop the pain and suffering that comes from cancer.
One of the things I appreciate about CChange is the intercultural focus of the organization. Would you speak a bit about that?
I think what we've tried to do is get together from the three sectors, public, private, not-for-profit. That's an unusual collection of folks. At the same time, we've been very cognizant of the fact that cancer's something that affects all of us as a population, but it also affects a certain portion of the population disproportionately. And so what we really want to see happen here is us to pay attention to the issues that are cultural in their direction. And as we become increasingly multicultural as a country, then we're going to have to be increasingly sensitive to how different people and different groups of people look at these issues in order to get the actions done that we believe need to happen. One great example of that is if you look at our health disparities initiative, is we sit and we think about health disparities, but there's no one-size-fits-all solution to these different cultural views of what cancer is and how one should respond to it. So we have to have the collection of all of those eclectic groups sitting at the table and being part of the conversation.
There are many areas of interest or focus that CChange will take on. It seems that right now one of the pivotal topics that you're bringing to the forefront is that of palliative care.
This is one of our 6 major initiatives that we're engaged in. But we came to it through the back door in a sense. The question that our organization was dealing with is, in an era where we're all talking about cost containment and how do we hold down costs of healthcare, et cetera, we felt like the issue of the value for the dollars that we spend actually disappeared. And so we started talking about how do you change and get better value for what we spend, not just how do you get the cheapest thing that you can spend. And as that happened, we began talking about, well, where are high value things that we know work, that we can do something about, and work on those and incentivize those, and where are low value things that we do that we can get rid of. Well, quickly, what came to the forefront on the high value opportunity was palliative care and hospice care, the two very important quality of life interventions for patients. And that's where our membership said, let's go there first because we can make a big impact in a short amount of time on those issues.
How do we begin as a culture that has such a difficult time talking about dying,
Yeah.
Looking at end of life as a failure in some way? How do we begin to overcome those social obstacles that are just so tinged with stigma?
Yeah, and this is a very foundational problem for us. We're a nation that likes to win all the time. We don't want to ever, quote, lose. And so this idea of giving up, quitting, or whatever never really enters our human psyche. It's something that we just avoid like the plague. And unfortunately, the truth is we all are at some point going to go through a stage of our lives where we are going to die and ultimately die. And I think what happens is, as a culture, we resist that so heavily that we don't really have the opportunity to engage in some of the things that actually would help us and our families and lead to a better quality of life. Now, how do we get there? I think there are 2 things that we have to do. Number one, we have to start having some adult conversations in this country about death and dying. It happens to all of us ultimately. We don't seem to be able to have that now. It's become a political issue. The whole concept of death panels is a great example of how people bought into an idea that somehow we can continue to live forever, which is silly. At the same time, and in a different direction, we also have to look at this idea of what's winning and what's losing. And this idea that winning means we keep trying and fighting, et cetera, right to the bitter end, versus the idea that winning may be I'm going to lead the best quality of life for as long as I can, and I'm going to get the best out of the medical care system I get, is a different way to look at it. And we have to start a national conversation, and we have to start different conversations between patients and their providers that get us to the place that we look at this differently.
And there needs to be a paradigm shift and an understanding of redefining what is palliative care.
Yes.
Because the first association is, okay, that's end of life. Well, palliative care, right. Our goal is to bring it into the dialogue very early on, to normalize it and make it part of the discussion when patients meet with their medical oncologist, no matter how treatable their cancer is.
Right.
Because palliative care is also pain control, and patients have pain, whether it's end of life disease advancement pain, it could be surgical pain, it could be remnant pain from a prior procedure, and patients are living with pain, and pain management is a huge component of palliative care.
It is indeed. And I think what's really important here is that palliative care was often considered, still is by many, as synonymous with hospice care.
Yes.
Those are 2 different things, and one of the things in CChanges initiative is we've separated goals in those 2 areas. What's important about palliative care is it begins at the point of diagnosis. And from that point on, we're talking about how do we control the symptoms and the other things that cause distress to patients throughout their treatment, whether they are cured or whether they ultimately progress and die. And I think what's important as we think about how we look at these things is that we understand that palliative care is about physical symptoms like nausea and pain control, as you mentioned, but it's also about our social well-being, our emotional well-being, and even our spiritual well-being. And there are good services that can be provided from the point of diagnosis that don't imply that someone's going to die. And we have to get over the cultural stigma that's what happens. Hospice care occurs when we begin to reach the place where we say, you know what, this really is not going to be cured, and we need to start talking about how we can progress in a way that it gives us the best quality of life until the end of our life. But those are two separate things. Well, I think the most important thing is to recognize that we do have a full agenda. One of our agendas is palliative and hospice care, which we talked about related to value. We also have a prevention agenda. We're very concerned about health disparities and cancer health disparities, which are getting worse, not better. In this country, there's certain segments of the population we need to help bring them up to the same level that we have as a population as a whole. Very concerned about the workforce issues. We, even in this morning's meeting, have talked about workforce shortages and potential shortages there. And then we also want to make sure that we stay connected to what's happening in states and tribes and in our territories and affiliated nations. The real change that occurs out, as you know, with what each of us decides to do with our providers or as individuals. And yet that change can be motivated heavily at the community level. And while we work on things at a national level, we want to support what communities are doing as well.
I want to thank you really for the opportunity to be an active member of CChange. I'm proud of everything CChange stands for, and I really love your commitment.
Thanks.
You've been with the organization a long time, and it's great to see it grow.
Thanks, and thank you for participating.
My pleasure. Tom Kean, CEO of CChange.
Thanks.